Hello, my name is Laura Edison. I'm one of the secondary supervisors for the Georgia EIS position. There's another video in which I introduce myself and talk a bit about my background and my experience as an EIS officer at Georgia DPH. But I'm going to take a minute now to tell you a bit about the position itself and about public health in Georgia. So the first thing that's really important to know is that Georgia is a decentralized state. That means that we have 18 health districts. Each health district has at least one epidemiologist. They have programmatic work, they have emergency coordinators, and a slew of other staff, depending on the size of the district. We work very closely with them. They do the majority of the day-to-day surveillance work and case follow-up with support from the state as needed. When an outbreak happens, usually the health district takes the lead on it, but if they need support or don't have the capacity to do so at a given time, then the state will support them. So we, in essence, kind of serve a role similar to CDC does to the states, but we do to the health districts. So that's kind of the structure of public health at the state of Georgia. Now, in terms of the Department of Public Health, we have two main sections. We have the Division of Health Protection and the Division of Health Promotion. Health promotion is programmatic work, and health protection contains epidemiology, emergency preparedness, the Office of EMS, and other things as well. So the EIS officer obviously is under epidemiology. We have a huge epidemiology department, somewhere I should know the number, between 150 and 200 people at this point. We have lots of different areas. We have acute disease, we have chronic disease, we have respiratory diseases, we have an injury section, we have maternal and child health. So there's a lot of different areas, and of course HIV as well. The EIS officer sits within the acute disease section. That's where most of the outbreak investigations occur, but has the opportunity to work across all of the different areas. And in fact, one of the secondary supervisors is the director of HIV surveillance at DPH. That's Jenna Gettings. So when an officer comes in to DPH, the first thing we usually do is have them go around and meet different people around the department, learn about the types of surveillance that we do, learn about the data we have, learn about surveillance systems that you might want to do an evaluation on, because that comes up very quickly and is something you need to jump into right away. Also learn about ongoing projects that you might be able to get involved with, or opportunities to start a new kind of larger project as well, or even just analytic projects. We have a ton of data all across DPH, so data access is certainly not a problem. There is a ton of surveillance systems for evaluation. So we bring you in, we try to get you oriented to the department and the work that's going on, and then kind of let you steer it from there a little bit to help determine what your interests are and where you really want to focus your efforts. Some people come in and are really eager to get field investigation experience. Some people come in and haven't published any papers and need to do that. Some people want to work on their analytic skills, or any and all combinations. So we really kind of let you take a little bit of the lead and try to steer you in the direction of projects that will teach you a lot and give you a good experience. And of course, you're going to work on a lot of outbreaks, and if there's any major responses, the EIS officer is always very involved with those. I know, most of us have had some large epidemic or pandemic that has consumed a big portion of our time. So in terms of supervision, you have various different supervisors. So Sherry Drensick, the state epi, is the primary supervisor. She supervised a ton of EIS officers and is really good at helping pick out projects and investigations that will be meaningful for an EIS officer, that will not just be grunt work or not go anywhere, but will be work that will help you meet your CALs, help you meet your skills goals. Then there's myself and Jenna Gettings, and we often are a little more involved in some of the day-to-day work. I am a CDC employee still, so I can help navigate some of the state CDC stuff and some of the administrative stuff at CDC as well. And then depending on what you're working on, be it an outbreak investigation, analytic project, a surveillance system evaluation, you're going to be working with various teams of epidemiologists throughout the department, and you'll get a lot of mentorship from those teams. We have so many skilled epidemiologists that have been with DPH for, in many cases, decades. We have very, very good longevity at the state, and are real experts in their field. So you'll be getting a lot of mentorship and supervision from there. In terms of CALs, most people have their CALs done in the first year. It's never a problem to meet those goals. There's abundant opportunity at the state, but I think the most important thing to know about the state is that it is a really collegial atmosphere. We support each other. We cut across teams to lean on people based on the skill sets that they have, and people across the department are really familiar with working with EIS officers and always happy to have them participate and even take on leadership roles within investigations or projects. So I think that I covered everything, but we are happy to answer any questions, talk to you more about the position, and see if you think it would be a good fit for you. So we look forward to meeting you at the conference.